Ready? Was that the signal to say we're live? Thank you. Good evening. This is B. Bass Knight, Chairman of the Dare County Board of Education, and I'd like to call this meeting, the special meeting of the Dare County Board of Education, to order. Today is October 1st, 2020. We are meeting at First Flight High School, and the time is a little after 5 o'clock, 5:04. We're sorry to be a little late getting started. I'd like to thank all the people who are joining us by phone, parents, teachers, and community members. We appreciate your support. We appreciate your interest in our schools, our students, and our teachers. I'd like to just introduce the people that are in the room tonight. We have a lot of people present, but we are under the 25 rule for being indoors and gathering, and we are socially distanced. Tonight we have board members, Mary Lon Balance, our vice chair, Harvey Hess, Frank Hester, Margaret Lawler, Joe Tauber, and David Twitty. We're joined by principals of our high schools, Chuck Lansing, First Flight High School, Beth Rooks, Cape Hatteras Secondary School, John Luciano, Manio High School. Our assistant to the board, Georgia Sellers, is with us, and our attorney, Rich Schwartz, is here. We are also joined tonight, the very important person, our superintendent, Dr. Farley, our associate superintendent, Sandy Kinzel, the director of elementary education, Kelly Flora, the director of middle and high school education, Dr. Keith Parker, our director of innovation, Johanna Parker. We have our technology specialist, Maureen Welch, with us tonight. And we are especially pleased to have Dr. Sheila Davies, who is the Director of Health and Human Services for Dare County. And, the Director of Exceptional Children, Dr. Rita Roberts, and our Director of Technology. I'm trying to get everybody in the room. Dr. Ashley McBride. I hope I didn't miss anybody. We're all spread out, and my back is to some people, so I think I have everybody. So we're very pleased to have all of you with us tonight. And we have an agenda in front of us. And I will entertain a motion to approve the agenda.
Madam Chair, David Twitty here. I approve the agenda.
Motion for Mr. Twitty to approve the agenda.
Second.
A second from Joe Tauber. Is there any further discussion? All in favor, please say aye.
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 Any opposed? Motion carries unanimously. The agenda includes the presentation and discussion of options for reopening schools, and we will hear this presentation from Dr. Farley. And I'd just like to remind everyone, if you wish to speak, please identify yourselves so the people listening can tell. I know it's hard to recognize voices over the phone. So, Dr. Farley, we'll move right into your presentation.
Thank you, Madam Chair. Good evening, everyone. I want to thank all of our board members, all of our leaders in the district who have joined us tonight, and got over 300 people currently on the call. So I want to thank the community for their involvement and support. So I've got a lengthy presentation, a lot to cover tonight. Our goal, as it was in July 20th when we considered reopening schools, is to provide effective and safe learning environments for all students, teachers, and staff. In overview, first off, I want to thank all our Dare County teachers. We are talent-rich in Dare County schools, and we're very fortunate to have 400 of the finest teachers in the state of North Carolina who have done everything that they can under the circumstances during the pandemic for the last 5 months, and really going above and beyond into providing support for children, families, and our remote learning program and protocols. I think this is a good time for us to reflect on our talent in Dare County schools. We're a top 10 performing school system. Our teachers are nationally recognized for the number of national board teachers that we have in Dare County schools. We have the 11th lowest teacher turnover rate in the state. The last time that student achievement came out, we had a significant number of schools that exceeded growth for the first time in 10 to 15 years, and I'm very appreciative of our staff. Also want to reach out and thank our parents. I know that this has been a stressful time, particularly with the start of the school year, and I know that we've got parents who are trying to hold down jobs, provide support for the children at home, come up with alternative ways that they can participate in remote learning, and our parents have gone above and beyond our wildest dreams in trying to support their children. We're very appreciative of their partnership. I've received, as the board has received, hundreds of emails in the last couple of months, and we're always open to healthy debate. We've got a lot of supportive parents. We understand that we've got parents and staff members who are on all sides of the issues, from still some fear and trepidation about returning to a strong willingness to get kids back in school. So we're very appreciative of the partnership and support, which has been fantastic, and it always is, with the high standard that our parents have for our schools and our school system. Tonight, the board can expect to give me a quick overview about what school's going to look like if we reopen on October 26th, or whenever we reopen. We've got 6 options that are coming before the board this evening. I will highlight those options up front, and then I'm going to have Dr. Davies do a COVID-19 update, and then we'll get into much deeper detail about all those options and talk about what they are, what the challenges are, what the opportunities are, what the needs are as we move through our meeting. We'll get into details about our virtual option application process. We'll talk about all the details around state requirements, around expectations for masks and health screenings and temperature checks, and what child nutrition looks like, what bus transportation looks like, and all those details. And when we get deeper in the meeting, I'm going to ask the board to make a motion on the preferred option, one of the 6. And if there is an option on the table where we are returning to school, the second request would be to do a calendar amendment, and we'll talk about that. And then the third would be, on the tail end of the presentation this evening, a discussion around middle and high school athletics and opening up athletics. So, what families can expect? Click, click, click. Slight technical delay. We'll get this straightened out. There we go. Okay, we're on. What families can expect when schools reopen? Schools are going to look different. Schools are going to feel different. Health and safety is our top priority, and following all the protocols that are necessary to protect and try to mitigate the best that we can any impacts of the pandemic and the coronavirus. Staying safe throughout the school day is going to include cloth face coverings. Face coverings have to be worn by every child who is 5 and older, every staff member, unless a child or a staff member has an exemption. Cleaning and hygiene and social distancing are going to be significant, and we're going to have to put a lot of structures, particularly in the first couple of weeks of school, because when you get out of your car and you're leaving mom or dad for the day, or a brother and sister who's dropping you off, you'll be asked to social distance for the first time. When you get on a school bus, there will be only 24 other students on the school bus. You will be wearing a mask to school for the first time. Transitions in school will be extremely slower. There is a limited amount of capacity in feeding children in the cafeteria. Classroom setups are going to be different. So part of our job and preparation is to try to problem solve every scenario, and then we've got a significant amount of training that needs to be done, has been going on with staff, and certainly when students return to our buildings. Changes to bus seating protocol, pickup and drop off is going to look different. We're going to have to run double routes with our school buses if pre-K-5 is going to school every day. And we'll get to some of those challenges a little later. Visitors to school will be limited, so parents will not be able to walk their children in the morning. Visitors will be restricted to when they're making appointments with the administration and if they have to pick a child up during the day for an appointment. Daily health screenings for all, and we've worked to try to be as efficient as possible in asking those 3 required health screening questions. We'll get to that a little bit later. School meals will be served in classrooms. Transitions will be slow, and classrooms will certainly look different, not only physically, and that all desks are going to be pointed in the right direction, but we're going to have to adjust strategies so that we are social distancing to the best of our ability, and still, which can be challenging, particularly with little ones when we get into literacy blocks, but we're going to have to amend the best we can instructional strategies, and there's a lot of requirements about not sharing manipulatives and objects and so on and so forth. When school opens, there will be all kinds of signs and decals that will be up on walls and on floors. And so we have engaged with a local partner, and we've got somewhere around 75 to 100, depending upon the school, signs that will be installed by most likely October 5th, 7th, somewhere in that range, that has a school logo. There are signs about, remind about the 3 W's, about social distancing, about hand washing, directions in schools, so on and so forth. Touched on this a little bit. Instructional strategies will certainly have to be altered. Sharing items, equipment, and supplies will be limited or not allowed. Fans at athletic events, if we open up athletics and programs, will be limited. We'll talk about that capacity in a little bit. Schools may be temporarily closed if there's positive cases, and an educated guess will be that we will have positive cases. And so part of the Q&A tonight with Dr. Davies is around what happens if there's a positive case in a school, and what does that look like? Students and or staff in those scenarios may have to quarantine. So part of the problem solving that we have to do is if a staff member has to be quarantined, if they are, and judging how ill they are, can they still perform or want to perform remotely while they're quarantined? If they aren't, who steps in? Who's that substitute? Who's available to step in when students have to be quarantined? We've got to put technology in their hands, and we've got a responsibility to provide them with remote learning for 14 days. So there's all these different scenarios that we have to plan for. Outside time will be encouraged, and that will be K-12. So we're fortunate, most of our schools, if not all, I believe, have outdoor learning environments. We're going to encourage a lot of physical activity, whether it's recess, mask breaks, which are needed, which can be done outside, physical education outside. We're actually, I've asked our maintenance department to build 50 picnic tables, and we are going to disperse those starting with our elementary schools to get 10 or 12 of those out at every elementary school, so that there's another option for eating outside, for outdoor teaching possibly, and spread out and social distance. So we've been trying to think about everything that we can do to support our students and our staff. Training and staggered entry will be needed, particularly for elementary, and we'll get to that a little bit if elementary is going to come back under one of our options. So, state requirements and recommendations. Reopening plans and scheduling. So our community is very astute and is aware. The North Carolina Department of Health and Human Services has come up with the Strong Schools NC Public School Health Toolkit. The state has also authored the Lighten the Way Forward document. These are 2 guidebooks that districts across the state have used over the summer in planning for reopening. The governor's office has worked with the State Board of Education and NCDPI and the Department of Health and Human Services in collaborating on all these updates. So we saw about a 130-page document in June, which is now about 160 deep, and there's been all these revisions as we move through the last couple of months. So currently, Plan A, and they started out with this, Plan A is minimal social distancing, Plan B is moderate, and Plan C is remote, which is where we obviously started. Governor Cooper on September 17th opened up the pathway for school districts to choose if they desire to choose for, to have an option where elementary students are coming back in Plan A. That is effective October 5th, and there are school districts, I've been asked by a few folks over the last few days, what are other districts doing? Everyone's problem solving, and they're trying to determine over the last couple of weeks since the Cooper announcement what they are going to do. And so Plan A means that pre-K-5 can come back every day, and there are requirements for social distancing in all aspects of the instructional program: cafeteria, hallways, bathrooms, gymnasium, of 6-foot social distancing, but Plan A does not require 6-foot social distancing in classrooms for pre-K-5. And as you recall, when we met in July and we worked through different scenarios at the time, there was a 50%, what they call density. They started with a 50% density model. And so we were working through trying to figure out how we could put kids, divide the number of kids that were in rooms in half and have a maximum of 12 students per classroom. That since is switched to, the definition is solely around 6-foot social distancing. So Plan A has changed a lot of considerations and options. So for 6th through 12th grade students, they are still operating under Plan B. We have no indication when there could be a shift there, but under Plan B, the health and safety requirements are different and more restrictive than Plan A. And certainly Plan C is still in play for districts that choose to want to choose to offer remote. Plan B limits density in schools as it relates to social distancing. And so when we talk about options that are coming before the board tonight in grades 6 through 12, those are all wrapped around the concept of having to socially distance by 6 feet, and that certainly impacts class sizes and how many students you can serve at one time. So this is to highlight the options that are coming tonight before the board, and then we're going to have Dr. Davies do a presentation, and then I'll get much deeper into all the details behind each of these options and the challenges and the opportunities. So option 1 is to remain remote. Pre-K-12 remains remote. The recommendation there would be through the rest of first semester. And if that is on the table, then I would suggest that we get into December to reevaluate. Option 2 is for pre-K-5 to go face-to-face, and 6-12 is on a hybrid. So in the verbiage from the state and the governor, their language is wrapped around K-5, and that's because NC Pre-K is a separate program. But for Dare County schools, it would be pre-K-5 going to school every single day. If we're still on target for October 26th, that would start the process, and then 6-12 would be on a hybrid. The hybrid that we're in favor of, and so that our community knows, we've had upwards of about 25 meetings over the last 3 months with our administrators. We have about 37 directors, principals, and assistant principals who have met several times in collaborative decision-making. And we've discussed every option probably 10 times over. And our recommendation on a cohort is to have a cohort class that comes on half the kids, 6-12, who come on Monday and Thursday, and then the other half come on Tuesday and Friday. We would split the alphabet so that families have their children going on the same days. And the reasons why we would not, some districts go on Monday, Tuesday, Thursday, Friday, and Wednesday is a remote all day and sanitizing school day, and could be an enrichment day, a lot of options on a Wednesday. We prefer the Monday, Thursday, so that there's not so much time that's stretched between when kids are coming in a building. So if I'm a Monday, Tuesday kid, I've got 5 days where I'm not getting instruction, whereas if I'm coming on Monday and Thursday, that gap is decreased. And we also, as we project down the line, if we've got all kids coming in on Monday and Tuesday, that offers us more opportunities potentially to remediate on Wednesdays if we want to bring kids back in small groups. And that's not something that we would do immediately, but we may strongly consider. So our strong preference from our administrators is the Monday, Thursday, Tuesday, Friday model. Under all the options except one, we would also recommend that we bring back students, certain students with disabilities who are in our extended content standards classrooms. We have one in each school where kids are in resource settings all day. And so under all models, 2 through 6, we would recommend that those kids come to school. There's about 80 of them across the district. Have high needs and don't necessarily always have the supports that are in place for remote learning, and they have higher need to be back into classrooms. And so under all options 2 through 6, we would still want to bring those kids back in. Option 3 is pre-K face-to-face every day again. 6-8 would be on a hybrid, 9-12 remote. And under this model, we would still bring the students in the extended content classrooms in. 6-8 would be on a hybrid. That hybrid recommendation would still be the Monday, Thursday, Tuesday, Friday method. And with 9-12 being remote, we've gone out and gotten a significant amount of feedback from our high school teachers who speak about the continuity of continuing classes with the same teacher. Thus, the concept of keeping those kids on remote. We actually have a lot of kids who are already taking online classes through COA. And under all these models, we would still prefer, if athletics are approved, for students, whether they're virtual or remote, to still have an ability to participate in athletics if they chose to. Under this concept, 9-12 would remain remote until January 15th or the end of first semester. That model would also mean that we would not have a standalone virtual school for 9-12. So we would have the continuity of all the teachers keeping the same children, our students, young adults, excuse me, they're 14 to 18, through the rest of the first semester. Option 4, pre-K 5 face-to-face, 6-12 remote. Under the original options that we presented to the Board of Education, it was a K6 and not a K5, and this has changed based upon opening up Plan A. So under this model, 6-12 would remain remote, and we'll talk about those challenges and opportunities, again, just highlighting what's going to be on the table tonight. Option 5 is everyone goes to school 2 days a week. So under this option, we would have an AB cohort. Again, it would be the Monday, Thursday, Tuesday, Friday model, and everyone K-12 would come to school 2 days a week. We would still recommend our extended content standard students to come to school every day. And option 6, pre-K-12, alternating weeks on a hybrid. So we would have cohorts who come 1 week, half the alphabet, and then the other half of the alphabet would come the other week. So on weeks when you're not in school, you'll be on remote. And we'll talk about all these challenges, as I said, in a little bit. So that's a highlight of the 6 that we will get deep into tonight. The virtual option for all our options has to be on the table based upon the current state mandates, where it has to be available for any parents and students who want to remain home and do not feel either they have a medical condition or their own reasons for wanting to stay virtual. So this is a current state mandated option that we have to provide under options 2 through 6. To date, we have had 44 Dare County Schools teachers who've applied to teach virtually. That is an application. That does not mean that's an automatic for teachers, and we have come up with criteria which will primarily be based on the number of students we have to serve in virtual and what the certifications are from teachers and what the need is with our students. We did not have an end date to the application process because we don't know what the board's going to decide to do. And so if there is a decision this evening to go with an option that is 2 through 6, then we will have a fast deadline for teachers to apply, which will be Monday. The teachers have had 2 weeks to think it over. Some teachers are probably awaiting, I'm sure, the decision tonight. And we will go to Monday and close out applications. We have opened up student registration. We also do not have a hard deadline for that. To date, we have 368 students who have registered, and I'll show you a graph in a little bit of where those students are coming from in the grade level. That number is relatively low. If you recall, in our July 20th meeting in our survey process, we had indicators from the community that over 30% of our parents preferred the virtual option then. So either they've changed their minds at this point, or more likely they're awaiting the decision tonight. And I would anticipate that number will grow exponentially if there's a decision to return to school. That deadline, we will keep that open for a week and close that out a week from today if there's a decision to return to school. Then a lot of work begins on trying to figure out where all these kids are who want the virtual option, who's applied, what the certifications are, and what that's going to look like in terms of serving kids in the virtual school. The virtual school option would be on the table through the end of first semester, and again, I would anticipate that we would reevaluate before Christmas with this fluid situation about next steps. And if it's just going to be for the semester, it's possible that the state mandate runs through the rest of the year. It's possible that stops at some point if we're all back traditional. Let's see. We have told parents up front, both in our guidebook and in our registration process, that it is highly likely that if they choose virtual, they will not have their current teacher. So we put that in writing. It's the first question you have to answer when you apply. We'll emphasize it again tonight. And the reason is because if we are back in face-to-face instruction, we've got to dedicate teachers to face-to-face, also possibly with remote learning responsibilities, depending upon the model, and the virtual will have to be a standalone. The only exceptions there could be if, say, there are some high school classes where we only have 1 or 2 kids who are taking a certain class virtually, and we may have to have some synchronous instruction with a current teacher. But for the most part, particularly elementary, it's a near lock that they will have a different teacher, which switching teachers is not preferred, but we have to offer the option. And we'll talk more about that. Again, we'll reevaluate, and we will create deadlines if the board chooses an in-person return option. So those will be hard deadlines, again, Monday for teachers, next Thursday for student registration. So here are where these students are coming from. So the students who have currently registered, we have, I believe as of about 2 o'clock, 362. And you can see the schools are coming from, with Kitty Hawk by far the most with 60, Nags Head Elementary 43, Manual Elementary School 42, Cape Hatteras Elementary 40, First Flight Elementary 38. The last 2 schools there, Hatteras Elementary and First Flight, have jumped tremendously in the last 7 days. At First Flight Middle, we have 39, Manual Middle School 18, First Flight High School 39, Manual High School 15, Cape Hatteras Secondary 34. So clearly lower numbers in Manio, and again, we anticipate those numbers possibly jumping up significantly based upon the decision. By grade level, here's the distribution. In kindergarten, 28, first grade, 35, second grade, 42, third grade, 34, fourth grade, 38, fifth grade, 47. So you can see the heavy numbers in elementary. Sixth grade is 16, seventh grade, 33, eighth grade, 29, ninth, 20, 10th grade, 17, 11th grade, 11, 12th grade, 18. We do have to follow, whether you're virtual or in face-to-face delivery, the K-3 classroom size requirements, and that cap is at 21. So it's possible, so in these scenarios, we may have a need for, say, a kindergarten teacher, if those, under these numbers, which obviously will change, a kindergarten teacher and a first grade teacher, and then someone who may split out and have to teach both. So that gets tricky. And what also gets tricky is that if the numbers continue to grow, we may have to take a traditional teacher and ask them to teach virtual. And so if there's say a third grade team of 3 teachers and we're taking 1, then those numbers would go up in the other 2 classes. But the more kids that are in virtual, the lower the class sizes will be, which is part of the decision making when you think about kids returning to school. So there's expected and unexpected outcomes in all these scenarios. Okay, yeah, the graphics aren't coming up for some reason, but we'll deal. We could just keep it moving. We have published we've got a couple graphs that aren't coming up tonight, apologies, but it's a definition of what's remote and what's virtual, because there's been some uncertainty, but I think as we move through time over the last couple of months, we got a pretty good understanding. So let's just keep it moving, Keith. Okay. So next we're going to ask Dr. Sheila Davies to come forward. I want to thank Sheila for being here, and I especially want to thank her because she and I talked 2 or 3 times a week over the last 4 or 5 months. I'm sorry. And Sheila's a wonderful leader and is a champion for students and community members. And she's also come in and spoke to our administrators, and she, of course, supervises the school nurses, which we're very grateful. We're one of 5 districts in the state with a school nurse in every single building. And Sheila's here to give us a COVID-19 update tonight. So welcome, Sheila.
Thank you so much. Thank you for the invitation to be here this evening. And before I get started, I want to echo your comments that you made early when we were starting about the staff and teachers. My other role, definitely my most favorite role, is mother. And I have 2 boys in the school system, and what they have experienced with their virtual learning has been remarkable. So appreciate all of the efforts that the faculty and teachers and staff have made. So tonight I just want to provide an update on kind of where we are with our case numbers. One thing that we've done for tonight's presentation is actually broken out the 18 and under population. So we'll go over those specific numbers. I want to talk about the health department case response, what we do currently and what we would do if there was a case associated with a school. We'll talk about the reporting requirements, show a recommended reporting dashboard that we're proposing. I also want to cover just a couple of key considerations, talk about our school nurse role and school health currently, and then be available for your questions as you have them. So on the Dare County dashboard, this is just a screenshot from today's numbers. Since we started testing back in March, we have 554. We've had 554 positive cases. 301 of those are resident cases and 253 are non-resident. Currently, we have 21 active positive cases in Dare County. And you can see there the age breakdown that we have traditionally done following the state model, reporting out 17 and under cases and cases 18 to 24. But as I mentioned a moment ago, we wanted to try to specifically for this audience give you a case breakdown for the 18 and younger population. So of the total cases, we've had 94 cases of 18 and younger. 53 of those 94, or 56%, are actual resident cases. You are probably well aware that we track residents and non-residents because of our specific situation with our tourist population. It was a request that our community asked of us early on to be able to report that. Most communities don't report, they only focus on the resident cases, but we thought it was the appropriate thing to do to provide all of this information. So then specifically though, looking at over on the right side of the slide, the number of resident youth cases, we broke it down even further to look at ages 4 through 18, so looking at truly your school age population. And we've had 49 cases. 16% of our current resident cases are age 4 to 18. This next slide shows you the actual specific number of cases per age. So you can see certainly the highest numbers of cases, almost 50% of the total cases, of the total 94 cases, are age 17 to 18. But then from there, you can see there's cases in pretty much every age. There's an anomaly, I guess, with a 6-year-old, but anyway, low numbers, or numbers throughout, spread throughout. So I wanted to take a few minutes to talk about case response. So if you look at the left side of the screen, that's really the traditional way. We would find out, we would be notified if an individual tests positive, whether it's a student or a staff member, someone associated with a school, and of course we would focus that association with the school, meaning they're actually in-person school, not just school age. So the predominant way we would be notified is directly from the testing facility, so whether it's an urgent care or Serve Pediatrics and Medicine, they handle or serve a lot of our pediatric patients. We would get notified at the health department 7 days a week of a positive test. If we're notified of a positive case, we immediately call the individual. Certainly if it's a minor, we'll call the family member, and we start our case investigation. So part of that discussion is interviewing them on where they've been, who they've been in contact with, how do they believe, if they know that they acquired the virus. And then we go into contact tracing. So who have they been around during their contagion period? The contagion period where we're focused on contact tracing is 2 days or 48 hours prior to the onset of symptoms, or if they happen to be an asymptomatic positive, then it's 2 days from the date of testing. So we would identify and collect any individual that they had contact with, direct contact. Direct contact is defined as being 6 feet or less from an individual for 15 minutes or greater. So anyone who meets that criteria would be identified as a direct contact, and I'll walk through what's involved in that later. If we are notified and through our identification we determine that it is a school-associated case, either by a staff member or a student, I will personally notify John, notify the superintendent, and the school nurse who covers that particular school. Because then we have work, which I'll talk about in a few minutes, that the school nurse will need to do. The other side of the slide would be if someone self-reported. Every now and then someone may happen to get their test result back before we are notified, and if they alert a school official, the superintendent is required to notify the health department or the principal. So that's what the other, but long story short, the process is still going to be the same as far as what we do with our case investigation. So the positive individual that's identified, again, whether that is a staff member or a student, is required to be in isolation for a minimum of 10 days. If they are symptomatic, it's a minimum of 10 days from the onset of their symptoms. If they are asymptomatic, it's 10 days from their date of testing. During those 10 days, the individual is monitored daily by the health department. One of our staff members calls to check on their symptoms to see if they need any supports. And monitoring their status, because at the end of that 10-day mark, if they remain symptom-free, they can be released from isolation. However, if they still have symptoms that are unresolved, then that isolation period is extended, and we keep monitoring daily until they've cleared 24 hours free of symptoms. I mentioned that we identify direct contacts, those who have been within 6 feet or less for 15 minutes or greater of the positive individual. Those direct contacts are required by law to quarantine for 14 days from the last date of exposure with the positive case. That quarantine period it's not negotiable. Oftentimes throughout this process for the last 7 months, we've had people say, well, wait a minute, I went and got tested and I'm negative. We do want people that are identified as direct contacts to go get tested. We recommend waiting at least 6 days, though, because of the incubation period. If you go too soon, it's likely to be a false negative because the viral load's not there to pick it up in the test. But if you go on day 6 or day 7 and you test negative, you still must remain in quarantine for the full 14 days. And that is because the incubation of this virus is 2 to 14 days. We have seen cases throughout the last 7 months where they tested negative on day 6 or 7, and day 10, 11, 12, they start developing symptoms. So that's just something to keep in mind as far as if we have to come in and quarantine, that it's a full 14 days regardless of a test. So I mentioned the reporting and the close communication that we will continue to keep. I anticipate it will move to multiple times daily, not just every few days, John, as we move forward. But if the principal or the school learns of a case first, then they're required by general statute to report that to the local health director or local health department. The state has established reporting that they're doing now. They report clusters of school cases. They have down at the bottom there is the link where they're reporting that. A school with 5 or more cases in a 14-day period that have an epidemiological linkage have to be reported as a cluster. Those reports are updated every Tuesday and Friday by the state. Currently, I think there's about 15 clusters in North Carolina schools. And the cluster is considered over once you have a 28-day period of not having new cases associated with that particular cluster. So that's something that we at the Public Health Department have to track and monitor and do the reporting for the state. We recognize, though, that while it's not a requirement to report locally, we think it's the responsible thing to do. Superintendent Farley and I met earlier this week to talk about what our local reporting could look like. We have been using a dashboard type reporting system at the county level since we started, and we're proposing a similar dashboard that would be updated weekly, shared on both of our websites, that would provide any new positive school affected or associated cases over that given week, and what does that percentage look like based on the number of students that are going to school face-to-face and staff. So it would cover both. So that's just a sample of what that would look like.
So before we leave that point, I do want to get some Board of Education input on that concept. This could be something that's linked on our COVID-19 webpage off the website. The upside to the reporting is to be transparent with the community and for the community to be able to access cases as they in numbers so that, we kind of downplay the conspiracy theory of I heard this or, what are the numbers at this particular school. So I don't think we necessarily have to decide that tonight, but I would expect that at our October 13th meeting that we land on a decision regarding this.
A couple of key considerations that I just wanted to stress since I was with you tonight. So we know through proven science that the most effective ways we can protect ourselves are by following the 3 W's. That's been shared consistently in North Carolina and in other, across the nation and globe as well. Maybe not in that same vernacular, but the 3 W's basically are ensuring physical distancing. That's having 6 feet or more between you and other people, wearing your mask, and hand hygiene. The majority of spread that we've seen in Dare County continues to be and has been predominantly through direct contact. So folks that have not been able to stay 6 feet or less, whether that's been by choice or just the nature of their work or their home life. So as you move forward, just a recommendation from public health is to keep that physical distancing in place if you can, regardless of what option you choose to go with. Switching gears for a moment and talking about our school nurses. As John mentioned, we are very fortunate in Dare County to have a school nurse for each school location, so 10 nurses. Unfortunately, we are down a school nurse right now due to a vacancy that happened right before the school year started. We're in the process of recruiting and hope to have that position filled. But Dare County is very fortunate, and it's a pretty unique position across the state. Often schools have to share a school nurse, or a district shares a few nurses. Wanted to talk about just, or give you a snapshot of what it looks like for a school nurse. So the first bullet there, that was for school year 2017-18. Our nurses saw 37,602 acute care visits. Of those visits, these are students presenting to them or being sent by the teacher, or runs the gamut. 2,200 of those, approximately 2,200, were sent home. The others they were able to provide care for or support and help them get back to the classroom. In addition to that, they also have chronic visits. Those are students that have chronic medical conditions that need daily, sometimes multiple times a day, interventions by our school nurses. Over 2,000 visits in elementary school, 724 in middle, and 1,665 in high school. In school year 17-18, 62 students were on long-term meds that were administered at school. 40 students were on short-term meds, which means less than 3 weeks. Those were administered at school. So these are part of those chronic visits that the school nurses are managing. In that particular year, 566 students had chronic medical conditions that the school nurses were helping manage. This is very different than even when I was in school or some of you are in school. The complexity of our student population has just grown over the year, but it's wonderful that schools can provide these educational opportunities, and it's speaks to the need and the powerful work that the school nurses do in our schools. And then I'm sharing similar data for the 18-19 school year. I don't have the data for last year since it wasn't a complete school year, since it was interrupted by the pandemic. Yes.
Tauber, I have a question to ask you.
Certainly.
You have the numbers of 554 positive cases, I think. Was that the number you gave?
Since we started testing, 554.
Okay.
Mm-hmm.
How is that collected? In other words, are those tests that you administer, or is that data that you're collecting from other sources?
That is data that we're collecting from other sources, primarily from our urgent care centers, our hospital, and then we also will receive, if someone tested positive that's a resident, say outside of Dare County, maybe they were in a hospital in a different area, but they're a Dare County resident, we would get that. And that's a much smaller number, but that's reported through a state reporting system.
I saw your website, and it does have the number 554, but then I'm also looking on another website which talks about coronavirus cases in Dare County, and it lists 282 cases.
So the state website, that's probably what you're referencing, because they do have that number. So they are only reporting, the state will only report the resident cases. And the state is also behind us often several days in reporting cases, because they have to, the way they get the data is it comes from the center to the lab, and then it gets sent to them electronically. We get the phone call directly, and part of that is because we have such an amazing relationship with our healthcare providers in Dare County. So that's the discrepancy in those numbers.
And so I understand the 554 is not only the residents of Dare County, but the outside residents of Dare County.
Correct, right. So the 554, 253 of those are non-residents.
Okay, thank you very much.
Certainly. So back to looking at the role of the school nurses. As I mentioned, they're attending to multiple acute illnesses a day, approximately 20 visits per nurse per day at each school. They're doing the daily medications, calculating and administering insulin to students that require the medication. We have a fair number of asthmatic students with severe allergies. They're supervising, documenting, and performing catheterizations as necessary, tube feedings as necessary, assisting with orthopedic injuries. They assist in annual health teaching, and often in many of our schools, they're the first intervention for mental health issues, and that is a role that they've been playing more and more, not only with our students, but also with our staff team members. And with COVID, so in addition to all of these, now our school nurses will be heavily involved in tracking students to know their quarantine period. Also, if they show up symptomatic and they have to be out for 10 days, they'll be tracking that data. Or if they, if a student shows up and has a new onset of a cough, for example, has to be out for 10 days unless they go get tested. If they weren't a direct contact, they could get tested. If that test is negative, they could return back to school. So there's different variables, and the school nurses will be our frontline staff in helping track that information to make sure that that communication is there for the school administration. And then we will be having them assist us with the contact tracing as well. We certainly have a team of staff that have been working on that at the health department. They have been part of that team. And as we shift, if you return to school, we'll shift them into helping specifically with our school contact tracing.
Dr. Davies, Frank Hester, I have a question for you. How are we going to be able to distinguish from a child that maybe has the flu-type symptoms, compared to maybe testing or having COVID?
So on the surface, you won't be able to know. That's where the value of testing lies. That case, if a student presents with flu-like symptoms, because it could be COVID, it could be flu, or it could be some other respiratory virus or illness, that student would be encouraged to seek care at their medical provider, and they will be running all of those tests. They can do a flu test, they can do a strep test, they can do the COVID test. But the student would have to remain out of school until a diagnosis is determined, or if they refuse to go get tested, then they have to remain out at least 10 days.
Okay, so it'll be treated the same until it's proven different. Thank you.
Correct. Mm-hmm.
This is Margaret Lawler. You sort of answered my question, but I just wanted to be clear. The nurses in the school will not be giving COVID tests. Is that correct?
Correct. Thank you. They will not.
And Mary Ellen Balance, Frank, I think that a strep test and a flu test would come back a lot quicker than a COVID test.
Right. So currently, strep and flu, you can do a rapid test in any of the provider offices in Dare County and get that back during that same office visit. There's some movement in that direction with COVID tests, but right now there's still some concern over the sensitivity and specificity of those tests. But the technology is constantly changing, so we'll see. We are, for the most part, getting results back now within 24 hours. Sometimes it drifts to 48, but very rarely is it beyond 48 hours that it's taking to get a full PCR COVID test back.
Sheila, this is Farley. Plan A is we highlighted the social distancing requirements throughout a facility. Require 6-foot social distancing except everywhere in a classroom. We cannot feed every child in the cafeteria. There will be classrooms with 16, 18, 20 kids taking their masks off and eating lunch in a single classroom. Do you have concerns about that?
The safest recommendation, in my opinion, is social distancing the entire time children are in school. So, yeah, my concern is if you're in the classroom and you're not social distancing. So, my recommendation is to social distance throughout the entire day, which would require, I guess then, as you're saying, smaller class numbers.
Okay. A couple situational questions. And we've talked about these just so that parents are aware, students are aware, teachers are aware. If a student is on a bus, we've got 24 kids, and the driver tests positive, it's likely that we're going to quarantine all 24 of those kids, correct? And then the same for school-based situations. So a third grade teacher has got 18 kids in a classroom, he or she is tested positive, the likelihood that we're going to quarantine the entire class is very.
So I think in the classroom scenario, to me, that's a little easier than the bus. The classroom, yes, because you've been together now for an entire school day. The hope is that social distancing can occur, but if you have a class of 20 students with a teacher all day, there's no way that you can say that they were able to stay 6 feet apart for those 7 hours. Bus to me is a little bit trickier,
right,
because you could have someone that got on only 5 minutes from school, they wouldn't meet that criteria. Or with the size of the bus, perhaps the one student that went or two students all the way and sat, they were able to stay further than 6 feet apart.
Dr. Davies, this is Harvey Hess. Just to be clear, that your recommendation that you just gave is not the recommendation that the governor and the state has given. They have said that it's fine, put our elementary school students in a full classroom, and you just said that you didn't agree with that. But that's not the state's recommendation, that's your recommendation.
So the way the state presented the plan is you all have the option, every school district across the state has the option to go with Plan A, but you also have the option to go with Plan B or Plan C. So
But the state has authorized Plan A.
absolutely, you have
Okay,
the right
so
to go
the
with
state-
Plan A.
The state health department's authorized, along with the governor, Plan A. Okay,
Absolutely.
all right.
Yep.
Thank you.
So, any other questions?
Uh,
Okay.
Yes, B. Bass Knight. At one point, if there is a teacher that tests positive in a classroom, at what point would we then move from quarantining that one classroom to perhaps quarantining the whole school or closing the whole school?
So you wouldn't move to quarantining the school. We only will quarantine if you meet that definition of 6 feet or less, 15 minutes or greater. And I asked the state, we have state calls every Tuesday, and that was my question this week to the state, was anticipating of, okay, do you have some guidance on if you have multiple clusters within a school or multiple classrooms that have been impacted, at what point do you provide a recommendation to the school that, hey, you need to shut down? The state does not have an answer for that. They are still evaluating and looking at the science and data, but there is nothing right now that I can give you that says if you have X number of classrooms or X percent of students that you should shut down. I will share, throughout the summer, you may have recognized different businesses have closed because of information they've shared. The health department doesn't go in and close any of those businesses. We've never said you've got to close. Often what you find is they run into staffing challenges or staffing shortages because of either the number of folks that have had to be quarantined because of a positive case, or just they need the time to clean and sanitize and take a deep breath and figure out who can even work, next week, especially if you've got a handful of staff that are now out for 14 days. So right now that's the same guidance that I would share with the school, is basically it's going to be based on your operation unless the state can come out with additional information.
Thank you.
Some states have gone to like a decision tree matrix where a certain number means you're closed. The samples I've seen are like 15 or 20, and I guess in North Carolina it might be like cluster specific, you would think. So I think it's situational, and what I would expect if there are scenarios where there's a bunch of cases in a school, obviously Sheila and I are talking, we're not going to make some decision about closing a school unless we've had a Board of Education meeting, so I could see us asking for a meeting of the board. I do think we have to be as conservative as possible in making decisions around quarantine. So like the bus example, although there could be some kids in the back who came by, we're going to have parents and students who are concerned about their child and whether they came into contact in some way, shape, or form. So, I would err on the side of quarantining. Where it gets tricky is, let's say that third grade teacher's in with their 18 students all day, but then he or she's then in the lunchroom having lunch with 6 or 8 peers. We're going to have teachers who teach multiple classes. Then that's where it kind of gets hairy. And, obviously we're going to lean on Sheila, Health Department, and the nurses with contact tracing. And these are all reasons really why I think we need to think about being transparent with numbers and reporting to the community, not as a scare tactic, but so that it alleviates, so we're being transparent. But again, we can talk through that. But I think one of the bigger concerns is not necessarily the school closure, but could be if we get 7 or 8 cases in a school and then overnight 75 kids want virtual, or 15 staff members have gone to providers and they're getting medical exemptions, and then staffing that school gets really tricky. So, we can talk through scenarios, but the reality is, an educated guess, we're going to get cases, and we're going to have to deal with it, and hope that we don't get in cases where we have to close schools. But that's not going to be something that is, that'll be a school board decision. And, we'll just, everything's situational and using good judgment and communicating with the public and certainly working with our officials.
Okay. Thank you.
Frank Hester again. I have one other question, a little out of line. This question is actually directed towards the lawyer, Rich. I was just wondering, this isn't a perfect world, which I know we don't live in, but what's the likelihood or the possibility of being able to establish some sort of baseline for the teacher staff so that when school went back, we're able to say that before the kids came, teachers, people that would have contact with the kids were tested and there's no COVID that's existed. Is that something that's outside of the pale of being able to do? I know you probably can't force people to do that, but I'm trying to figure out a way to calm any fears to know that this is how we started and anything else would be an outside influence after school opened up again.
I don't know that that's a legal question. I think it's more a county health department question, but with school systems we've been working with all across the state, we've had some schools that have closed the school because of one positive case. Durham just closed Hillside High School, I think for the second or third time today because of one positive case. And I don't think you're ever going to get a baseline. You can't get a baseline of 0 anyway because you're going to have the possibility of false negatives on the testing, and because as Dr. Davies mentioned, you could have the virus and not be shedding enough for it to show up on a test in any event for I believe it's 6 days. Isn't that what
We
it
recommend
is?
waiting at least 6 days
Yeah.
from
So I don't
symptoms.
think that's possible. And in terms of liability, if you're thinking of liability versus reassurance, we're exempt from liability as long as we post a notice in all of our buildings explaining that we're exempt from liability. So there was a law passed by the General Assembly that did that this couple of weeks ago, well, a couple of months ago.
Harvey Hess. Frank, just to clarify, were you asking about testing the teachers in advance?
Yes.
It was specifically talking about testing teachers in advance. And you're saying, your answer is still the same, Rich, that we're not going to get a 0 baseline and we're going to wait 6 days and so forth and so on. Is that an issue or a problem?
I don't know if we can mandate teachers being tested, but we could ask teachers to be tested if we wanted to, or we could set up a testing program.
Well, the first 2 questions teachers are going to ask is, who's paying for it?
Right.
Is everyone taking it? And then question 3 is, are you testing all the kids?
And I would also add that test is only as good as that day. So it's a snapshot of a day. And so, if you test them on a Wednesday before school starts, on a Monday, let's say, or a Thursday, and they have exposure over the weekend, that test really is kind of irrelevant when you start on Monday.
Just trying to think of everything.
Yeah,
I
no.
can.
I
Yeah,
just
no.
just wanted you to think of that side too. So, yeah.
There's no current state mandate to test. And Rich, you're working all over the state. You're tuned in, plugged in. There's no school district that is testing teachers or students.
No.
Right, and right now that's not part of any guidance recommendations either to do that.
I'm just clarifying.
Yeah. Yeah, no, you're right.
So last thing, I feel like I would be remiss as a public health director if I didn't put a plug in to get your flu shot. We're getting ready to head into flu season. That's why this slide's in here. But also, I am hopeful that the measures that that are in place and have been in place, not only are they to protect you from COVID, but I'm hoping that if we do adhere to these, they're going to help us with other respiratory illnesses like flu or other illnesses that we see. And some of your GI illnesses that we seem to spike in school in the fall and winter months. So I'll remain available for questions if you have any.
Thank you, Shayla. Appreciate it greatly. Thanks for being with us tonight and all your work.
Thank you, Sheila. We appreciate it.
Appreciate it. So we're going to switch back to the Google slide presentation and get deeper into the options. And at any point in time, jump in with questions, please. So just reviewing option 1, this is where pre-K 12 stays out remote. So our opportunities under this, it's the safest method for protecting the health of all stakeholders, particularly for students and staff with underlying conditions. Teachers and students are in routine remote learning, continuity for teachers and students, especially semester 9-12 classes. The challenges here are many. Continue to monitor internet device access, which in the big scheme is a smaller challenge compared to managing student engagement long term. Not possible, but not academic impacts for every single child, but certainly we've had kids who have not had face-to-face instruction in five months. So we've got significant academic impacts, certainly. Childcare hardship for parents and guardians continues. Remote learning is not as effective for our primary special needs students. More congregating outside of school, economic impact on families, and limited relationship building and socialization.
John, can I make a comment?
Sure.
Joe Tolliver. In terms of the opportunities for the safest method for protecting health, that basically speaks to if those students do the things that are necessary while they're in this remote situation, such as social distancing, wearing their mask. So I mean, they do face, my point is they face risk at home.
Sure.
Or if they go out into the community to go shopping or so on and so forth. So there are risks going outside as well, I mean, in the home.
Well, and different kind of risks that continue to add up related to mental health and stress and socialization and well-being, so certainly, absolutely.
Thank you.
The needs here are really somewhat minimal unless we're on remote for an entire school year. So the needs would be continued data costs for Wi-Fi hotspots. I think we've distributed about 140 of those to date, and updating devices for long-term use. Pardon? About 140. Mm-hmm. Oh, no, 140. Sorry, I got a little New York on you, I guess. Oh, thank you. I appreciate that. Option 2, pre-K 5 goes face-to-face, 6-12 is on a hybrid, and we've talked about our significant impacts on the cohorts and our significant preferences with the cohort model, Monday, Thursday, Tuesday, Friday. So the challenges and opportunities, needs here. The challenges, pre-K 5 students have the opportunity to attend face-to-face instruction every day, huge boom. 6-12 have opportunities to get back in school in face-to-face delivery in some capacity in this mode 2 days a week. Reduces density, or technically the density mark on 6-12 campuses, so we're following the 6-foot social mandate. We actually considered in our hybrid models the concept of maybe having to have 3 cohorts versus 2. So the idea of 3 cohorts was around some of our high school classes have got 32, 33 kids in it. And so we were trying to figure out, would we have to split those into cohorts of 3 and go on some cohort 3 rotation, whether it's weekly or every goes, cohort goes Monday and Tuesday, another goes Thursday, Friday, or Wednesday, Thursday, and then Friday, Monday. But we feel like we've got the numbers where we can get it down to 2, so that's advantageous. We would run ASEP, so if we return pre-K 5 every single day, then we would open up our ASEP after-school daycare programs. The challenges, reducing exposure risk in pre-K 5 settings, and we had some conversation obviously around Sheila. I think the biggest concern that we have and teachers have is if we have 18, 20 kids in a classroom and they're taking their masks off for lunch, does it mitigate, how much does it mitigate the possibility of exposure? Scheduling and staffing challenges. There are staffing challenges in every model. Every model except remote. So it dependent upon the model. If options 2 through 6 are used, we've got challenges in how are we have certified teachers to teach all the kids who are virtual. One unknown for us is once teachers do opt in, we have a hard deadline on application for virtual, how many of those have exemptions? So if you have an exemption, then you have to teach remotely or virtually. And do we have the students, do we have a need for your certification area to work with certain groups of students based upon who's in the virtual school? So staffing challenges in all these models can be significant. Pardon?
I got a question about
Yes.
ASAP, about the ASAP.
Yes.
If we're gonna allow, oh, I'm sorry, Mary Ellen Balance. If we're gonna allow ASAP, what guidelines are we gonna be under for masks and all that stuff?
Same guidelines.
So we're gonna keep,
We have to. Anytime a student is on the grounds of a school facility, they're expected to follow the protocol, including athletes.
they won't technically be in a classroom, so would they have to follow the 6-foot rule?
They won't technically be in a classroom. They could be in classrooms. Most of the time, our ASAP programs, kids are meeting in cafeterias, some classrooms, and in gymnasiums. So ASAP is actually easy as far as meeting all the social distancing requirements because we typically have 50 to 60 kids. The only kids in the building, we can spread them out everywhere. But they have to follow the mask mandates, all the other same requirements.
Okay, just want to clear.
Yeah, and we could limit enrollment, and part of that is, we've had to furlough ASAP staff. And so with approval tonight, then we are going to be, we've got staff willing and ready, but we've got some staffing challenges.
Beep asked tonight, the question I have on the ASAP, if we do put them in different rooms throughout the school, will we need more staff members with the ASAP program to maybe
We may
use
need more staff
classrooms
members, and it will also
cafeteria, playground?
Sure. So yes, the ratios will likely change. So we may need more staff members, and it adds another layer to our custodial responsibilities with additional sanitizing of those classrooms and the playground structures. One thing that is developed this week is the CDC has eased the guidelines on disinfecting playground equipment. And as you've seen in research through the course of time, it seems like contracting COVID from objects seems to continue to whittle down. And those lists decrease. So it's just a cleansing soap and water on playgrounds. So that's saves on disinfectant, and it's a little easier to manage. But yes, we would most likely, and I would anticipate, well, you don't know. I would anticipate if numbers are down with the number of kids who are in virtual, the ASAP numbers could come down, but we also know we have high need for daycare in the district. We would not provide ASAP in a hybrid model. So the ASAP program would run if we're up every day in pre-K 5.
Thank you.
A significant challenge for teachers in the hybrid. If you're 6-12 hybrid, it's an adjusted workload on instructional staff. So if you are a teacher, whether it's a K-12, any hybrid model, you will have students who you would teach live, and then you will have students in a hybrid who you also have responsibility for on remote. Teachers see this as one of the major drawbacks as we've gone in and had our staff focus groups. And so there are some districts that still expect teachers to teach live during the day to kids who are home on remote. And we do not think that that is good for the teacher. We don't think that's good for the kids who are live in that classroom for that to necessarily have to happen. The approaches could be multiple depending upon, and we intend to get deep into strategies for teachers. Our intent would be to do a lot of recorded lessons. We would do away with kind of the current schedule we have with remote with some of the live grouping. We'd have recorded lessons. When kids coming into school, particularly older kids, we could send independent work home on the days they're not in school. So there's different approaches we have to take. The upside to the model is instead of teaching 20 kids on a particular day, I may be only teaching 9 or 10. So I've got less kids, and I could technically replicate lessons for the other cohort once they come back in. But classrooms and kids get paced at different places, and Lord knows we're all over the place with 5 months of gaps in instruction. And so there's going to be a significant period of transition coming back in. But teachers do see this as a heavy lift in the hybrid model.
John, let me make a comment in reference to that. We're going to be making a decision today, and you would be in charge based on all the issues, the implementation of that decision. And you just expressed some of the issues that are involved. You think that you could work through those issues and resolve whatever option we decide to do?
So I often tell our administrators, one of our biggest responsibilities is to be problem solvers. So, I see that as part of our role and our work. And I also think that we have a culture of being proactive and trying to be prepared. And so we have talked about every single possibility. I mean, sometimes you wake up at 3 a.m. and you think about something that maybe you didn't cover in a meeting, and what ifs and what are you going to do. So if whatever direction the board asks us to take, we will move and be as effective as we can. There are going to be drawbacks in each of these plans. There is no great plan where everyone is satisfied. And unfortunately, we also have to be very flexible and very adaptable. Part of my role has to be an advocate for our teachers and to listen, and that's why we go out to schools and we get input, because we have a lot of talented folks with great ideas, and I believe in collaboration, and that's just not a term that I think folks that are around the room tonight would tell you that we live that, and that's really why they're here too. So there'll be an adjustment period. It does take, if you are a teacher who's had some tough transition in remote, and maybe, and we've done a lot with digital learning. And last spring we had a buffet of 40 different professional learning options. We've got several this fall. We've done a lot with building teachers up to teach other teachers, and so we lean on our teachers to do that because we have that talent base. It will take some time. In all these scenarios, another factor is the calendar. So if we started October 26th, we're up against Thanksgiving. We want to stagger in elementary. Thanksgiving's coming, then Christmas break. There's I think our high school principals were counting a certain cohort may only have 16, 18 face-to-face classes, 12 in some spots. Yeah, scary. So it's going to be a transition time. I think there's unrest for everyone with the stressors around this and the unknown. And if you're a teacher, we've got veteran teachers on the Board of Education, you like structure, kids like structure. And we just have to adapt, Do I think we need to get kids back in school in some capacity? Yes, absolutely. And teachers will adapt, but these are real issues. The other issues the teachers, and we'll get to kind of their top 10 concerns a little bit, are around the pace of the day is much slower. So we basically have to schedule every transition from A to B so that we don't have classes running each other with social distancing. That knocks down planning time. The amount of time that you actually instruct during the day is going to be restricted compared to what it used to be. We got to keep kids outside more for mask breaks. Adults need mask breaks. And so these are in teacher responsibilities. These are all concerns that are at the forefront, and we will adapt, and we will be successful to the best of our ability. And we have 400 committed teachers who, on a daily basis, do all they can to support kids above and beyond. So whatever the directive is, we will do it, and we will do it well. But there are outcomes with all of these options that could be a challenge. Couple others under challenges under this model: scheduling challenges with ensuring families are in the same cohort group. So, where that comes into play, let's say we have a high school class of 30 kids and 2/3 of the alphabet is, 20 of those kids are in the A through N's, okay? So there are some challenges with schedules to try to ensure that kids are coming on the same day. Obviously, it's best for parents and for families for the middle school and high school kid to come on the same day, but there's some maneuvering that has to be done depending upon where class rosters fall with the alphabet. particularly in classes where we may only have one teacher for a certain subject area. It gets tricky. Possible academic impacts we can say for every model. Needs planning days added prior to October 26th for device collection and classroom setup. More importantly is classroom setup. So if we do a return in one of the options 2 through 6, one of the recommendations I would make tonight is to take 3 work days, October 21st, 22nd, and 23rd, for teachers to set up classrooms, for parents to have an opportunity to bring devices back into school, but more importantly for teachers to prepare. A lot of our teachers, because we made the decision on July 20th, did not come in and set up their classrooms. And they also have to come in and prepare because they may be teaching remotely and face-to-face delivery at the same time. So that was a definite takeaway from staff, which I agree with. Pre-K-5 staggered entry. So if pre-K-5 comes back every single day, we would like to take a staggered entry approach with bringing the older elementary kids in first, 3, 4, 5 for the first week, so that they can get down all the structures. They're going to be role models in the school. The schedule that is different. Social distancing is different. How you go to the bathroom is different. Where do you get water? We're not supposed to be having machines in school with water fountains. So we can train kids up, the older kids first, and then the next week we bring in K2, and we'll probably have kind of a separate schedule for preschool who always staggers kids in smaller groups. In the staggered concept is about preparation. We're going to have to do a lot of training because school is going to be very different. The other thing that I actually didn't put in here, but I do want to emphasize, we have kids coming in back into our buildings who are much different places. Some kids who've been home and not socialized, and they've only got maybe 1 or 2 buddies on the street. Some kids who've not seen their friends in forever. Families who've had, illness, COVID-related or not been able to get out on a ball field. So there's a lot of wellness, mental health related listening that we need to do with kids as they come back in, get them into routines. I think there'll be some joy in getting kids back. I know there will be joy in kids coming back in buildings. It's been good just to get out and see teacher groups in the last week, to be honest with you. But we also have to be understanding about where kids are at and what their needs are going to be. So we almost have to double down in thinking about our mental health supports, regardless of the option. Option 3, so this is pre-K 5 face-to-face, 6 to 8 hybrid, 9-12 remote. Opportunities here, again, pre-K 5 has a chance to come back for instruction every day. 6-8 has the opportunity in the hybrid for face-to-face delivery 2 days a week. Reduces student density in 6-8, continuity for 9-12 teachers and students, especially high school semester classes, ability to run ASAP in elementary schools because the kids are coming every day pre-K 5. Challenges, again, the exposure in the 6-foot social distancing challenges, scheduling and staffing challenges, again, adjust a workload, scheduling challenges with ensuring families are in, so this is redundant in some spots, they're in the same cohort, possible or likely academic impacts. Needs, planning days again, and again, staggered entry. This model may upset a lot of 9-12 stakeholders because they would be the only students who would not be getting face-to-face delivery. A lot of high school teachers see this as good continuity. Kids have the same teachers. A lot of teachers feel like they're just hitting their stride and remote, and we do have a lot of kids who already take online classes. Option 4, pre-K 5 face-to-face, 6-12 remote. Pre-K 5 face-to-face, 6-12 remote. Opportunities, again, preschool, pre-K 5 is in every day. 6-12 maintain continuity through the first semester, and we can run ASAP. Challenges, again, reducing exposure in pre-K 5. 6-12 remote, it's a challenge to continue to monitor internet device access. Academic impacts, student engagement, more congregating outside of school, limited relationship building. Again, under needs, we want the planning days for pre-K 5, staggered entry, and again, lesser needs are around device costs and availability. Pre-K, option 5 is pre-K 12, alternating day hybrid. So in this model, everyone goes to school 2 days a week. Opportunities, everyone has a chance pre-K 12 for face-to-face delivery, a couple of days a week. It's a phase-in of remediation enrichment opportunities on Wednesdays. Challenges, again, childcare hardship on the days that elementary kids aren't going to school. No ASAP support for after-school childcare. Limited classroom devices for pre-K 5 due to remote day device needs. So where it gets tricky is we've got all these devices that are home. It's somewhat simple if pre-K 5 comes back every single day because we bring all the devices back. Where it gets hairy is we have a lot of teachers who do use digital technology on an everyday basis. We have several programs that kids access in different rotations. And if all the devices are home, then as much as I do think we need to do a lot of core face-to-face instruction, particularly in the first 3 to 5 weeks of the school year, but we can't only go so long without having some access to digital technology. So we've got different scenarios based upon devices, but that's not my top 10, but it's in my top 50. Again, Joe liked that one. Adjusted workload on instructional staff with face-to-face and remote planning. Teacher availability for office hours. So this is also a stressor for hybrid teachers. I'm teaching face-to-face 2 days a week. I'm also have remote learning responsibilities. Currently, most of our teachers are having open office hours from like 12:30 to 2:30 or 1 to 3, where students and parents are contacting them every single day and even beyond those hours for coaching points, support, questions, availability, help me understand this concept and work with my child. And so teachers would see another, in a hybrid model, another responsibility is, I've got to teach all day, I got to provide remote, and I still need to provide office hours deep into the night, and how do I still go home and make dinner for my kids and see my loved ones and have some outside time? And Lord knows their teachers are always planning well into the night anyways. But that's real for our teachers. Scheduling challenges, again, with ensuring families are in the same cohort group and needs are very similar. One recommendation I would make is that if we go with this model, where pre-K 5 is on alternating days, daycare challenges are prevalent throughout our entire county. They are for our teachers, and if our teachers can't be teaching with children, then that's very impactful. There's no substitute, as great as we have many wonderful substitutes, there's no substitute for the classroom teacher. So I think if we're in a hybrid with pre-K 5, we should run a staff daycare so that we don't have teachers calling in sick or needing substitutes because they gotta be home with the kids. So that's all about delivery to the kids who need it. And one of our scenarios with staffing is, beyond quarantine and folks who need exemptions, virtual, is if we didn't provide, if we're on this hybrid and we don't provide staff daycare, there's a strong likelihood that we may not have our particular teachers who have younger kids available all the time. And that's problematic. And you can imagine if you have a student, you got a couple of kids, they've been out of school for 5 months, and now they've got a substitute teacher for 2 weeks. No slap to substitutes. We love you. We need you. Several of them are retired teachers who are excellent. But there's no substitute for our qualified everyday classroom teachers. Option 6, pre-K 12 on an alternating week hybrid. Again, everyone gets at least they get more than 2 days a week, but everyone's getting face-to-face instruction. In this mode, it's every other week. Continuity for students receiving 5 consecutive days of face-to-face instruction, less interruption if quarantine is needed. So this is not our preferred option by our administrators. If you recall in our original survey, the alternating week concept was the least preferred by our parents and least preferred by staff. And one of the reasons that our administrators are not too high on this model, but again, we want to give options, is if we have a student who's in school for 5 days, then with weekends in the week they're off, that's like 10 days. And so we feel like remote productivity may go down. but we're putting all the cards on the table. There's still under challenges, childcare hardship for parents, limited classroom devices under this scenario with having to have them home and at school. Adjusted workload again for teachers, teacher availability for office hours. You can see the continued themes, extended time between face-to-face and remote instruction. And the needs are what we've covered previously. So some staff feedback. So we've made a commitment since I've been superintendent to go out and have staff focus groups. Last year we had 33. We had 3 meetings at each school, and our intent is to go out generally for an hour and a half and say to staff, first, thank you, and what's working in Dare County schools and how can we improve what we're doing. The staff value that, and as we moved in the fall, we've done that. And we have also had several staff members who participated in the feedback process with us. They were pretty split in the models, but their themes, which we'll get to in a moment, are pretty consistent. We've also had provided the board with over 50 comments that parents and community members have submitted prior to this meeting. Although it's a special call meeting, we don't have public comments, but we have kept a summary of concerns and good things that have been shared. And certainly, I know I've personally fielded probably 150 emails from parents in the last 4 to 6 weeks. So some summary feedback from staff. Top 10 teacher concerns: risk of exposure to COVID-19, especially if pre-K-5 is on Plan A. Students adhering to social distancing and wearing masks. Hybrid option planning responsibilities and staffing issues, which we've talked about. Child care concerns we've touched on. Transition in new routines with so many non-student days and holidays coming up in second quarter. 9/12 schedules and responsibilities in virtual. Effective use of instructional time face-to-face with so many new protocols. Effectively teaching while wearing a mask. Risk of exposure of staff who travel to multiple sites. So we're going to try to the best of our ability. We don't have a lot of staff who travel, but some do. And we may, instead of like a half-day model, switch schedules up where someone would just report to one site as opposed to going to 2 on a particular day. Collection redistribution of one-to-one devices. Now, these will all be concerns, or they're making a decision October 1st or February 15th or March 29th. So, but these are real, and we have touched on many of them tonight. For your information, we touched on this a little bit previously, but as an update, the age ranges of licensed staff, and you can see the range. So this is licensed staff only, the age range, and the reason this is relevant is around the age range of 65 and above, who are more likely to be in a range of staff members and or community members who might be more likely to get COVID or COVID-like symptoms. So this is very limited when you see the 4% of licensed staff with teachers. Where that changes significantly is the age ranges of classified staff, where you can see that overall classified staff, we have many more who are over the age of 50, 48 who are ages 65 to 74, and actually 5, God bless them, are over the age of 75. Bus drivers, what's that? Yeah, you did. They are. They're probably more energy than I do. Bus drivers, you can see the same range. Most of our drivers are between 50 and 74, and so you can see that breakdown just for board information.
Dr. Farley, Frank
Yes.
Hester, have you lost any bus drivers? Are you going to have any staffing problems with bus drivers?
Yeah, good question, Mr. Hester. So yes, we are down 10 regular drivers. So Mr. Chandler has been concerned about that. And in fact, I think we had 3 who peeled off last week. We are parking 3 buses because we may not have the need, which is a significant cost savings, which also means that we don't have to hire 3 additional drivers. But we are out hard recruiting to try to find 7 regular drivers to run routes. Our bus drivers will be, we'll get to transportation here in a few slides. We have a lot of bus drivers who can run double routes. We already have some bus drivers who run double routes. That's problematic, particularly at First Flight Middle School, where we run a lot of double routes, and certainly although we're getting further out from hurricane season, that becomes problematic on an annual basis. Yes, so.
I know you're getting to that slide, so that double route means there's probably an earlier start for
Yeah,
some kids.
yep, we'll get to that in just a few moments. But yes, we're down in, we kept, unlike a lot of school districts, we kept almost every single employee employed, classified or not, up to May. And then we had to shift some gears with child nutrition and bus drivers. So we are pressing the pavement to try to recruit some full-time drivers. Substitute poll. So a lot of our substitutes are retired teachers. We thought it was worth our interest in to get data on input from substitutes. Would they return to work and work in a pandemic? So we polled substitutes to ask them if they would return to face-to-face. There's 196 substitutes on our list. We got a hold of 134 in a short amount of time. And the numbers, these are surprisingly higher than I thought they would be, thankfully. So 72% of those who responded said they would return. And then we've got some maybes and a bunch of no's, but that's actually better than what I anticipated. I thought we might be, excuse me, in the 50% range. Maybe Ms. Kinzel shares that and her staff, thank you, have run down this information. The maybes depend upon the circumstances in the model. What's loading? Get a sandwich, get a drink if you're hanging in there. There we go.
By the way, Joe Tauber like that.
Thank you, Joe. Yeah, we need an intermission. It's fine. I mean, this is just just a little bit of messaging on, kind of follow up on what we talked about earlier with all the decals and signage and so on. You can go to the next slide, Keith. So, around the country, we're starting to hear a little bit of talk about, airflow, and certainly that's part of decision making when around the maximum number of people who can be in buildings and so on. So I have fielded some questions from staff and a few parents about airflow in our buildings. So Mr. Gerganis, our facilities director, has put together a summary, which I'll share in the next 3 or 4 slides. Russ's wife is having a baby in the morning. Congratulations. And so we didn't want to have to ask him to stay this evening. So, but Dare County Schools has air filters that meet all test requirements, are recommended by the EPA, and have a high MERV, which is minimum efficiency reporting value rating. MERV is a system used to evaluate the efficiency of an air filter based on how effective it is at catching particles of varying sizes. Air exchange rates are important and is determined by the size of the unit, the space it provides, and often include person count within a space. Our HVAC systems are complex and are designed accordingly by ASH RAE standards. We control outside air along with airflow with dampers, economizer. I'm trying to read this. Yeah, thank you, Joe. The staff keeps kidding me. Well, A, I can't read. B, I can't see. Features, economizer features. Thank you, Ms. Balance. Point to you. Principals are back here cracking up, I'm sure. CO2 set points and outside air minimum flow. Different areas of the school require different air exchange rates. For example, the carpentry shop requires a higher rate because of the amount of dust, paint fumes, and etc. So, common areas with larger occupancy limits, such as a gym or cafeteria, require a much higher rate as well. If CO2 within a space climbs to a point over the set point in the space for parts per million, then the system goes above design, exhausts the building, and brings 100% fresh air. We as a district, we do consult with a mechanical engineer and industrial hygienist is needed to include annual indoor air quality checks of our schools. So we're meeting well above standards is the bottom line. And part of the key is pumping in enough air and then air going out. So air is flowing throughout our buildings. One thing that is comes up, you hear about opening up windows on buses to get more air in, and it actually is counterproductive in schools to open up the windows in schools, and these next couple of slides explain why. And hopefully they don't include the word economizer. Yeah, I know, thanks. It's been a long 6 months. Parents at home are saying, we know. When we open windows inside our schools, there are a few things that happen. First off, the buildings are designed to operate as a closed envelope, meaning windows and outside doors shut. The air exchange rate discussion revolves around this topic pretty heavily. Our HVAC systems operate on multiple inputs that generate from humidity readings, CO2, return and supply air temperature, space temp, and many, many more. Common problems that arise from opening windows are as follows: allowing dust, dirt, pollen, and other allergens inside unfiltered versus our units filtering the controlled amount of air our BAS calls for. Condensation problems if we're opening up windows all the time, particularly during summer and spring months. Opening windows throws off the humidity within a space. Multiple classrooms and offices on one unit. Example, if one classroom opens a window, it would create an unbalanced situation for the other classrooms. The same unit supplies and airflow. So it's counterproductive. We always create a slight positive pressure in our buildings based on that closed envelope design. Opening windows would create a negative pressure. Negative building pressure could create areas of mold and mildew around cracks and openings that are allowing that outside air inside unwanted. The CDC states that you increase ventilation by opening windows or adjusting your HVAC. Our HVAC programs are doing this for us, so we don't have the need. To help with this, we are bringing our buildings online early before school and keeping it on later after school, allowing time to flush the system spaces with fresh air and so on. So just in being transparent and getting a couple of questions from the community, I thought it was important to share this. And as we move through time, we'll certainly engage with Mr. Gerganis again at our October 13th meeting. So changing topics, entry to school protocols will be significantly different. So the current mandate is that everyone has to wear a mask unless you're less than 5 years old or if you have an exemption. So masks, we will be vigilant about masks in order to follow the state mandate and to protect other individuals. Obviously in K2, everything's situational, and it's going to take some time for kids to adjust. A lot of us have worn masks. I know I personally can't stand even going in Harris Teeter for 45 minutes in a mask, let alone teach for 7 hours. But we're going to have to follow the mandate, and if students come to school without a mask and they don't have an exemption, they'll be given a mask. And for our older kids who may be insubordinate, if they don't put their mask on, then they go home.
John, there might be, Joe Tauber, there might be some familiarity with the mask by this time for children. So
absolutely.
It's not, it's not unusual for them to have to wear that. I'm sure they're in their daily lives wearing the mask now.
Yeah, good point, Joe. And I think that particularly, masks have been really emphasized since like May. So I think we're all kind of getting used to it. So, but it certainly for our teachers, teaching 6 hours, it's different remotely and wearing a mask, be able to take it off. But we will be vigilant with the masks. Certainly 6-foot social distancing protocols. Staff and students or their parents must answer the 3 health screening questions. This is a state requirement before they enter a building, and we'll get to in a very efficient program we're going to use to tackle this efficiently and quickly. Visitors are limited to appointments only. So these are state mandates. Parents will not walk their children into school in the morning. This is a transition for our little ones, but we have to limit the amount of visitors that are going into schools. Any stakeholder entering a facility will have a temperature check via thermal temperature scanner, which we'll get to here in a moment. And they also have to answer the 3 health screening questions. So if mom drops off her 2 little ones in the morning and she's got to pick one of them up for a dental appointment at 11, when she gets to the building, she has a temperature check and a thermal scanner and has to answer the 3 health screening questions. Anyone with a temperature over 100.4 will be asked to leave the campus. That's adults. Students with a temperature over 100.4 will move to a quarantine room until a parent can pick them up. So Each school has a designated area near the front of the school that is a quarantine room, which is empty, and we will have an adult who will supervise with PPEs as needed if someone has to be quarantined. And of course, we would wait for parents to come get their children.
John, I have a question.
Yes.
In order to get the, I'm sorry, Mary Ellen Balance, in order to get the exemption, what will be required?
Ms. Kinzel, you want to take that, please?
And that will be for students and staff, right?
Yes. Yes.
For staff or students that request an exemption from the face mask, it has to meet certain criteria, which is outlined in the mask wearing policies and procedures. And it includes medical issues, breathing issues, those types of things, which we can then request to have medical documentations to support that particular request. The other criteria that's outlined in the exemption really has to do with things that are maybe beyond medical. And for some of our students that may have severe cognitive developmental delays that may not be able to wear those, then that might be something that we can consult with Dr. Roberts and their IEPs to confirm without any kind of medical documentation.
What's going to be tricky is we'll go through a period of time where, a student might come home and they're having dinner at night and mom's asking how the school day went, and, the student shares, well, Mr. Smith, my carpentry teacher, isn't wearing a mask. And then questions start to formulate about, is the school following the protocol, and why isn't Mr. Smith wearing a mask? Or even more likely, kids are coming home and, a couple kids in my class aren't wearing masks, well, why not? And then questions start to come. So, we can't have kids who have exemptions walking around with a sign on them, so we just have to, our community's going to have to trust that we're following the protocols, and those that have an exemption, it's for a reason, and same with our adults. It will be a transition, but kids are adaptable, and we'll get there.
Dr. Farley, Frank Hester.
Yes.
Quick question about the younger kids coming to school. Will the parents be able to walk up to the door with the kids? How far can a parent come to help the younger kids into the school?
So, good question. So my thought would be that they, as long as they are socially distanced, they could walk up to the door and then exit in a manner where they are socially distanced. Now, my recommendation would be, we've got kinders who would be entering for the first time, and we may want to, and maybe first graders, and kind of, beyond that, trust that our kids are going to, particularly after the first week, be able to adapt. So the less congestion we have, the better off we're going to be, and our ability to social distance is better. But what we can't have is, Dare County Schools is very parent-friendly, and we've got multitudes of parents who walk their kids into the building every single day, and we've got to minimize visitors, and it is in state protocols and mandates. So it would be preferred outside of the first week that we drop and kiss them goodbye and see you at 3. So within reason, but part of that is also going to have to be, we're going to get no trial period. And if there's too much congestion, then we may have to say everyone just drops their child, So it's going to be a transition.
Thank you.
Sure.
John Harvey Hess. I'm sure you guys have already thought about this, but if not, it might be a good idea through our local media, all of our local media, to come up with a top 10 kind of thing, just like the idea of exemptions for masks. Should you hear this, you already know this, and just put it out in front of them. The proactivity of that could dissuade a whole lot of problems for things like dropping the kids off and the mask and the exemptions for masks. So not only, I'm sure that the school can, you guys can send something out to the parents and shoot something out like that, but I think also if you come up with like a top 10 list
Sure.
of things that you think people might have questions about,
Sure.
to get it out to the local media might be a good idea. And like I say, I'm sure you guys have already thought about that, but
Well, anytime I send an email out via Blackboard, we've got parents who are in the media, and generally within 3 minutes it's out there. So that's pretty convenient. But to your point, yes.
but I'm also talking about not just the parents, but the community. So
Oh, yeah.
because everything disseminates through the community from the parents.
Yeah.
And I can tell you because it gets disseminated to me, and I'm sure it does to the other board members as well.
Sure.
So it's not just people that have students in school, it's the rest of the community as well, what's going on with it, because it's part of their community as
Sure.
well. So,
Yeah,
anyway.
absolutely. Yep. Good idea. Okay, so daily health screening. There we go. Thank you, Dr. Parker. So we have engaged with a program in a company called Healthy Roster to be very efficient in the daily health screening protocols. So instead of having a clipboard and having to ask all 400 kids who are coming through the schoolhouse those 3 questions and the 100 staff members, we've got a system where we will deploy a symptom survey platform, and it provides an assessment of the North Carolina symptom screening checklist questions, and it's sent out via text every morning. So this is a convenient way and a quick way for us on a daily basis to get parents to say, to answer those 3 health screening questions. And they are different, a little different at middle and high versus elementary. So at middle and high, have any of the children you're dropping off had close contact within 6 feet for at least 15 minutes in the last 14 days with someone diagnosed with COVID, or has any health department or health care provider been in contact with you and advised you to quarantine? The second one, since you were at school last, if you had any of these symptoms, and it lists fever, chills, shortness of breath, new cough, new loss of taste or smell, and that list has come down over the course of time. Third, since you were last at school, have you been diagnosed with COVID-19? If someone answers this question in the morning, then they will get a response, and it goes into the school database, and then there's an expectation they don't come to school that day. With elementary, so our concept is K-8 parents will all get the questions, and then dependent upon the needs, 9-12, we have some high school, most kids have phones, not all. And so we may send a combination of the students, 9-12, and their parents both getting the questions to ensure that someone's getting them, and then we're getting the answers and keep it moving. At the elementary level, question 1, if any of the children you're dropping off had close contact within 6 feet or at least 15 minutes in the last 14 days with someone diagnosed with COVID-19, or has any health department or health care provider been in contact with you and advised your child to quarantine? 2, do any of the children you're dropping off have any of these symptoms? And it lists them similar. And since you were at school last, have any of the children you're dropping off been diagnosed with COVID-19? We will have a window, most likely 6 a.m. to 8 a.m., where we would ask parents to answer this on a daily basis, and it will be much more convenient for them to answer this before their kid gets to the schoolhouse. If they do not answer, then we will have the data, and we'll have an ability administratively to pull down the list, and then we would ask at the doorway. So we're still kind of working through some of the logistics. And we have ways also to create rosters, so the football team will be able to have a list, or if the volleyball team with board approval starts engaging in preseason activities next week, we can get a roster of the volleyball team, and then they answer those health questions before they come on campus for practice. So we've got different ways that we can, in staff lists and rosters and so on and so forth. Ms. Bass-Knight, it looks like you want to ask a question.
So if a parent or student checks that they have a symptom,
Yep.
a cough or whatever, that will go directly to the people who are checking the students into the school, so that they'll know
Yes.
that they have that, in case the parent does not keep them home, keep the child home. So
Yes.
they'll know. Okay.
Yep.
And then we will turn around at the door.
Yes.
Okay.
And if the child still shows, then they would go to the quarantine room.
Okay.
Dr. Farley, I know that the elementary principals have talked with Ms. Flora about trying to get some things speeding up. if you'll see the little icon at the bottom of that screen, Chandler Smith would have been the student with a green check mark on the screen. They're talking about having parents be able to provide that in the drop-off lane so they can visually see that it's been done and completed
Before
and
they
not
get-
having to wait until we go back and pull the roster and be able to
Right.
see from the
So-
dashboard.
So they'll just show that before anyone's released from a car.
Right,
How
that's
about
correct.
bus
The
riders?
That's where it's
Bus riders will be a little bit different, but we'll have those broken down into groups that we'll be able to check them before they get off and start getting into classrooms.
Okay, thank you.
Next, so another way that we can efficiently get through the mandate to do temperature checks is we actually started installing in Cape Hatteras Secondary and Cape Hatteras Elementary yesterday, thermal temperature monitoring units. So you can see in this picture, it's a little vague, but the shorter units that are on the right are for elementary school, and we put those on tables or desks or kiosks. And then the taller units are for middle and high school. And so in this concept, they're placed right inside a school door. They have to be inside because of needs with consistent temperatures and how it impacts the system. It can't be outside in humidity and so on. But students would just walk into the building. There's no more handhelds. We have a large monitor where you would have someone stationed. And if someone comes through and their temperature is 100.4 or higher, then that student with facial recognition comes up instantly on a computer, and then we would discreetly go and ask that student to go to the quarantine room. This keeps the flow of walking into a building at a very rapid pace, and part of the technology is it can take several temperatures at one time. We are very fortunate that the county commissioners are supporting this adventure. They've got COVID-related funding that they have helped support this initiative upwards of about $88,000. So many thank yous to our commissioners who've approved supporting Dare County schools with this installation. It also is beneficial for us long-term because of the facial recognition capacity of these devices, well beyond any impacts of COVID. We actually could use this as part of a visitor system in the future. We might be able to download or ask parents to register, get their picture taken. We got facial recognition as they come in and visit in school. So that is helpful if we get back to some normalcy where parents are walking their kids in every day. They just walk through the scanner, facial recognition, and then a flag would come up if it's someone who's not registered in our database. So multi-use down the line. School transportation. So talked a little bit earlier, 24 students will be on a school bus. All students must sit in their assigned seat, so this will be a non-negotiable. And I'm going to meet with, if we've got buses rolling, I'll be meeting with the bus drivers sometime in the next 10 to 14 days with Mr. Chandler. Masks are required unless a student has an exemption. We do have an option which we don't prefer to have handheld temperature checks, excuse me, at bus stops. We prefer not to do that because we feel to back up traffic on some very busy roads. We're already backing up traffic, picking up kids. If the board does select an option where pre-K-5 goes every day, we will have to run double routes. So part of this is going to be on ridership. And if you recall in our survey in July, and it still could be consistent, the number of parents who said that they would not opt to put their kids on buses, that was pretty high. So if buses are going to be rolling, and one of our options is that we're getting into options 2 through 6, sometime next week we will start to register parents for transportation, and then we'll figure out bus routes. It's very likely in some of our communities that we have to run double routes in order to only put 24 kids on a bus. That comes with some heartburn. So financially, we're going to bus drivers who are on the road more often. Their responsibilities will be greater. The heartburn with parents will be, we're a very friendly school district in going to all places to pick up children, many times much closer than we have to, following DPI standards. We will still file DPI standards, but there may have to be some cases where we have got some centralized pickup spots. So in Collington example, we send one bus this way, and they're going through all the neighborhoods, and another bus going that way, and there may have to be a centralized pickup in order to be able to get kids to school on time. So that's all dependent upon ridership. We're not there yet. We've got to see how many parents opt. It's also possible double routes that we have to run buses a little earlier. In the models that we've run with Mr. Chandler, who's an exceptional director of transportation, we seem to be pretty close to the same bell schedule that we've used previously. So at this point, it'll probably be somewhat near the ballpark of what we've done. One of my fears was really running transportation models where we may have to significantly alter the bell schedule, but it seems like it'll be pretty close to what it is or was last year. So again, all this is dependent upon ridership.
I have a question.
Yes.
Fast night. How do the 3 questions play into the bus riders? I mean, how will we
Parents-
know that they've answered those questions? Parents will
They
do it
could still
before
get
they
on
go
the
to
bus, and a parent answers the question 15 or 20 minutes earlier. And,
Okay.
you know, a lot of this is on the, parents to know if the kids are sick and if they got symptoms,
Right, yeah.
If your child's got a 101 degree temperature, hopefully we're not sending them to school, and parents have good judgment. Yeah, there will be kids who are getting on buses, and then maybe their parent is answering one of those questions, and then we're intercepting them, and they're in the quarantine room, and we're sending them home. It would be a lot to ask parents to, honestly, it's going to take you 3 seconds to answer 3 questions if you pick up your phone, but it's a lot to ask parents to do that in a more discrete amount of, or more specific, smaller amount of time. So, our parents are very supportive, and I don't see this having too many bumps in the road. It'll take some time to work through the logistics, and, we will have some kids. There might be a roster 8 to 10 or 15, and hopefully not more, where we need some reminders, and we can work through that. But the good news is we're not standing outside with clipboards, and we're not standing in with single handheld temperature units right now. So we've got some very advanced technology, and I think we're being very proactive.
I do
Dr.
too.
Farley,
Thank you.
Frank Hester.
Yes, sir.
I know there's 24 students per bus, right?
Yes.
And if they are siblings, they can ride together.
Yes.
So does that count as 1 seat, or is that 2? I guess what I'm trying to get at, family members sitting together.
Yeah. So we could get to 26 or 28 if we got family members
Right,
sitting together.
thanks.
Yeah. Good question. School nutrition. So quick overview. As you know, USDA extended the waiver to allow us up to December 1st to serve meals at no cost. All students, face-to-face or virtual, or whatever the option may be, are eligible to receive a free breakfast and lunch up till December 31st. Meal service for face-to-face learners. In the cafeteria, we'll adhere to 6 feet social distancing requirements. We've actually walked in cafeterias with measuring devices and have gone through, working with Ms. Govan, and measured 6-foot social distancing at every single cafeteria table in the district. We have decals that will be on K-12 tables and cafeterias that say you may sit here or please sit here. And if you're not sitting in a spot where there's a decal, then you shouldn't be sitting there. All breakfasts and lunches will be prepackaged in one container or bag for meal service. The menu is planned with all required components with no additional menu entree choices. So the menu will still go out well in advance, and if there's a particular day where you don't eat peanut butter and jelly and you want to send bologna, have at it. But because of the high number of meals that we're going to have to prepare and hand out via kiosks, there's no way we could come up with menu selection. So at some point that'll advance, but currently we cannot do that. Breakfast will be served at point of entry via kiosk for students to pick up. So if students are coming in the morning, they can grab a breakfast and go to their classroom. Each breakfast is pre-bagged with all components and handed to the student. Students will eat breakfast in their classrooms due to time constraints and seating capacity. So again, with transitions, instead of having 150 kids in a cafeteria eating breakfast and then we're out in 20 minutes, that's going to slow up the start of the school day, and so we're adjusting schedules. Again, there'll be no additional menu or entree selections. Pre-K students will eat breakfast in their classroom. School nutrition staff will deliver specifically to preschool. Lunch is going to look a little bit different. We will have students in the cafeteria and classrooms because capacity is way down. We'll be on a 3-day rotation, most likely. The principals have developed schedules to rotate in. So on, Monday, we might have kindergarten and first grade, and Tuesday, second and third, and so on and so forth. Social distancing decals we talked about. We are going to be very vigilant in spacing time. So, you know, if you're in an average elementary school, you got the 4th and 5th grade kids are eating eating lunch, and they're on their way out the door. You know, that 3rd and 4th grade, they're already lined up and they're ready to get in there. We've got to pull back a little bit to ensure that we can sanitize every table and every touch point in a cafeteria. So the scheduling will have a 10-minute time period where a assigned custodian will go in and sanitize before the next group comes in. And we actually have discussed this a couple times over the summer, and we've decided that we are going to have one custodian. All the custodians have responsibilities with sanitizing, but one who will be very specifically assigned to sanitizing all touch points, doors, knobs, toilets, cafeteria, playground equipment, so on and so forth. Entry and exit signs will be placed on doors. Students will come to the cafeteria and pick up their lunch. Lunch is again pre-packed. No additional menu or entree options. Students not eating in the cafeteria will pick up their lunch from the cafeteria and go back to classroom. Pre-K students will eat again in their classrooms, and that will be delivered. We will still serve meals to virtual remote learners, so meals can be picked up 2 days a week. Students will receive multiple meals like we've done throughout the summer for future days for those that want it. Specific times will be set for meal distribution at the site. That will consist of hot and shelf-stable items, and parents will be able to pick up meals at one location. So our designated pickups for virtual remote learners in Manio, it'll be at Manio Middle. First Flight Schools, Nags Head, and Kittiawah Elementary will be at First Flight High, and at Hatteras Schools will be at Cape Hatteras Secondary. Just expect, so that we're being upfront and transparent with the community use of facilities. As you know, we get extensive amount of community use of our facilities almost on a daily basis. Executive Order 169 still limits mass gatherings. That remains at 25 people indoors and 50 people outdoors. So at this point, we will have to continue to suspend the use of facilities for community use until that cap gets raised. School calendar. If the board decides to bring back students in options 2 through 6, we've touched on this earlier, my recommendation would be to amend the calendar so that October 21st, 22nd, and 23rd are required work days for teachers. This will allow teachers to prepare their classrooms and/or instructional delivery methods if a hybrid combination is enacted. We have a draft calendar with those 3 recommended changes before the board. If the board chooses to choose option 2 through 6, we're recommending approval of that draft, and we still meet all the instructional requirements through the rest of the year as far as hours go. Athletics. So this is another separate vote we would ask. We're asking the vote to vote on an option tonight. We're asking the vote if the board to vote on a amended school calendar for an options 2 through 6, and also athletics. So just a little background. The High School Athletic Association has been on hold. They've moved the traditional sports seasons around to accommodate the impacts of COVID-19 and pushed it out. Sports are compacted into different sequences and the seasons are shortened. So volleyball starts in November. Football is pushed to, I believe it starts in February as an example. Fall sports do begin in November. The seasons are all shortened. So a typical basketball schedule is around 22 games. This year will be 14. The playoffs, there's schedules out for that. That is shortened, also dependent upon the sport. Some school districts in July started with some conditioning that was really basically calisthenics. And if you recall, in our July 20th meeting, or maybe even an earlier meeting, part of the guidelines were wrapped around, if you're in basketball, you only can have one basketball. If you're in baseball, you can't throw a baseball to someone else. So it's very limited, and we weren't too high on just bringing kids back to do jumping jacks and sit-ups. So, yes, sir.
John, my question would be, if we do open the schools up for athletics, what date would you insert there could you give us some guidance on that?
Yes, so my recommendation would be, if the board approves returning to athletics, middle and high school, that it becomes effective October 5th for preseason conditioning, and then the actual season where you can start formal practices leading up to games, I believe, is November 5th. So,
So would it be adequate then to, for the purposes of the motion, to say 5 October? I mean,
yes, sure. Yes, formal practices. Preseason conditioning can start with board approval Monday. And if the board does approve this, we have 2 meetings scheduled tomorrow with coaches. So I'm going to meet with every coach in the system, with our ADs and our principals, to talk about our protocols. They have to be followed by state guidelines. So wearing masks, sanitizing equipment, so on and so forth. And throughout there's a schedule for what they call dead periods, where you can't practice and so on. They have that schedule throughout the year. But our intent would be to start sports right away. Mr. Hess.
Yeah, John, are the folks in our conference are all on board with this particular time frame?
I'll defer to Mr. Luciano or Ms. Rokes or Mr. Lansing. Pardon? So, well, no, because some of them have started preseason conditioning earlier.
Yeah, they've already started.
Right.
So I mean, but
Some.
as far as we're talking about starting games November the 5th or thereabouts.
Oh yeah, I mean this is a statewide
Right.
system of scheduling.
Yeah, and other people have already started, but as far as this is a statewide series of scheduling right here, right? You're talking about.
The November 5th
Yeah.
is the statewide schedule of starting practice.
Okay.
But with districts, there's various degrees of districts who started preseason in July, and many did not, and some still aren't there.
Okay.
Yep. November 18th, first games. Yeah. So
Okay.
2-week period of time. Yep. Right. So Mr. Luciano, for those at home, is indicated that there is some practicing going on, but that's not supposed to happen yet. So,
Right.
but I think we're meeting the needs of our kids and our coaches and getting preseason underway, and then we would be ready to go in November for formal practices.
Thank you.
Sure. The other thing that's tied to us, just as a small detail, is we do have some coaches with overlapping seasons who are coaching multiple sports, and so we're trying to work through the nuances of what that looks like. Questions and discussion.
This is VBAS night. The sports would be on the table whether we're remote or back in school, right?
Yes.
Kids could play sports.
Yes.
Get one out of the way. Sure, we could do that. Let me turn around.
This is Harvey Hess. I don't see why we can't just go right through it right now, the whole thing, and starting with sports here and going there. With that being said, a quick comment from me would be, I think that, obviously John and his staff and everybody here, including every board member, has done their homework and really done a lot of work on this, and no one could ever imagine that we'd be looking at these kinds of protocols and this kind of stuff to do with just regular going to school or anything before this. But when we did this back in July, or August, whenever we did it, to decide to go remotely up until October 23rd, which was our initial date to reassess what we were doing and take a look at stuff. Obviously, there have been some changes in what the governor has allowed and what he hasn't allowed. And it appears now that the governor, and I can't say he was one of the most open governors, around, and this is not political, it's just that he's been pretty tight on everybody as far as this is concerned with his executive orders. And they have now allowed as an option some options that we were looking at back then. To that end, I would like to go ahead and make a motion that we begin our schools with the dates that we've talked about under option 2 with pre-K face-to-face, and we have a 6-12 hybrid here, and to start that on the with the change of the calendar, the work dates to start on the 23rd, is that when we start?
26th.
26th.
Would be
Okay.
the first student day.
So I'm making that motion.
And I'm going, this is Joe Tauber, I'm going to second the motion.
Okay, there's a motion on the floor to adopt option 2,
Yes, ma'am.
which is pre-K through 5, 5 days a week, and 6 through 12, a hybrid model, which would be 2 days, Monday, Thursday, Tuesday, Friday, with Wednesday being remote for everybody,
Sanitizing.
and sanitizing and intervention,
Yes.
those kinds of things, yes.
Yeah,
Okay.
that's
Okay.
the motion, the one.
That is the motion.
That is the motion.
The
To
motion-
begin on October 26th, which is the beginning of the second quarter.
Yes, ma'am.
Okay, there's a motion on the floor, and there is a second by Mr. Tauber. Is there discussion?
Yes, there's discussion.
All right, Ms. Balance.
Mary Ellen Balance. If the governor, and this might be something for Sheila, if the
I don't think she's here.
Okay. If the governor were to, because he's indicated that after 3 weeks in phase 3, it might be back to regular, everybody goes back under regular circumstances. What, would we still have protocols to follow, or would that be board decisions that we would have to make in policy on how we follow that? I mean, what does that look like?
So,
And let me explain, part of the reason I'm asking that is because if that's a possibility, then going back now and being prepared gets us one step ahead, I think. Do you see what I'm saying? So like, if we sit back and wait to see what he's going to do in 3 weeks, because we never know what he's going to do week to week. But if he were to come out and say, okay, we decide that we're going to keep things the way they are, and then he comes out in 3 weeks and says, we're going back full bore, then we're behind the 8 ball if we haven't started trying to implement some of these.
Are you indicating that he may, when he comes back in 3 weeks, he may say we can open up 5 days a week for all grade levels?
He could.
Well, then we could meet again and change, could we
Well,
not change our motion or change the decision?
Well,
Rich?
that's my question. So would we have to, like,
Well,
what protocol, I mean, would we?
What's the legal opinion on this?
Yeah. Would we still need to put into place some protocols for like the masks or the temperature or the checking in or?
You'd still have a lot of protocols left to put into place. Of course, and all of this depends on what happens in the future, and we don't know, but there's been no indication from the governor's office or DHHS or DPI that in 3 weeks it's going to be, wide open going back to school. There's been no discussion of that with any of the folks we're in contact with, and we've been in pretty regular contact with a lot of those folks.
Yeah, this is Joe Tauber. I agree with B in terms of the caveat and the potential of course, it's all speculation in terms of what the governor may or may not do, but obviously I think this board could come back and revisit the issue, and if it's open the schools according to the governor, then we could vote on that issue. But I think what's on the floor right now is option 2, which is the governor has allowed us to vote on. So that's where we are right now.
And I'd just add, and I think I'm in agreement with Mary Ellen on this. I'm pretty sure we're in agreement on this. But I think that under the circumstances that if we start now, we're opening the door, we're getting our foot in the door, we're getting people back to work, we're getting kids back to school, and the journey of 1,000 miles begins with one step. And if we don't take that step, then I think we're just we will be behind the 8 ball. So that's, the motion stands as
Yes.
And I have one other comment to make too. And the 7 of us here are going to make the decision. 7 members of the community are going to make this decision. But I don't think we're making this decision in a vacuum. Parents have had information on this virus since March. They've seen, they've gotten the information, but they've also seen their children at home and the impact that it has had on their children in terms of the loneliness, the isolation, the mental health issues, and they will ultimately be making a decision in terms of whether they send their children back based on what we decide. So I think we'll be making a decision, but ultimately they'll be making the decision to see whether they send their children back or not. One thing I'd like to say something to our teachers, and I'm going to state the obvious: kids learn better with a teacher in the classroom. I mean, that's clear. And we always talk about how teachers shape children's lives in terms of being that role model for the children. This gives them that opportunity to reestablish that connection with the children and to make positive decisions in their lives. So, and to hold children accountable. And they understand that there are certain children out there in the community that need to be held accountable. And that is much better to be able to hold those children accountable if they're in the classroom. So again, I think the 7 people here are going to make that decision, but I think parents are ultimately going to accept or reject that decision.
I'm going to add to what you said, B. Bass Knight, that you're right. The parents are going to make the decision because we are offering choices. We are going to offer the virtual option and then offer an in-person option for our students. And I think ultimately parents have to decide what's best for their own children. Our teachers, I think, have an option if they have a condition that prohibits them from coming to school and being in front of a classroom. They have an option to ask for a waiver with a medical exemption. So that gives them that as well.
And Mary Ellen Balance, I think, though, something needs to be expressed is that we know that when the teachers were surveyed, or half of them wanted to go back and half didn't. And so whether you're a teacher or you're a parent or you're a child, there are some people that are going to be very afraid of what's happening. And so I don't want to say that we throw out a motion right off the bat and not take into consideration and think that there's going to be some people that have some very big concerns for their families. And this is like a decision I have struggled with immensely. But at the end of the day, I think kids need to be in school.
Frank Hester, I echo the sentiment that I'm hearing, and I also see how, we've had an earlier conversation about start doing sports. So this kind of dovetails with that alignment towards having sports and getting people together. And I also agree that this has been traumatically stressful, looking at all the different scenarios. And the one thing that gives me a little peace is that there are options within this option. That it actually, from the way that I see it, it actually puts the parents in a position to make a choice too. And I feel for the teachers because I still struggle in my mind with how they're going to do this. So I continue to look at Dr. Farley, and I look at the staff that I've seen when we were going to regular classes, and there are amazing teachers doing amazing things. And I think, like what has been proven before in the past, is that given the opportunity and good guidelines, people will figure out a way to get it done. And I also believe that as a team, if it doesn't work, we can come back and reset and do something different. But at some point in time, we have to move towards the direction that everybody wants to go. I don't want to call it a new normal, but try to get back to something that we recognize as being sane. Thank you.
This is Margaret Lawler. I am in agreement with most everything that's been said. If we don't get the kids back, they won't start school till January 20th, and that's such a long time to be out of school. So for 6 through 12, it gets them back in even though they're only there 2 days a week. Like you were saying, the parents have an option. So if they're not comfortable, then they don't go. Some of the teachers maybe don't have an option. That's where my concern is. But I do feel the kids need to get back into school. And I hope we can revisit if something happens, and I think we will.
Madam Chair, this is David Twitty. I'm with like everyone else. Our kids they need to go back to school. Our parents are ready for them, and the majority of our teachers are ready for them back in that building. You know, we didn't become one of the top 10 schools in this state without those teachers and those students. And we have done so much over the years. This is we're taking a little back step, but I assure you by the 15th of January, our students and our teachers will be right on top again, because they're going to have the energy and the power and the love to make that happen. So
I
I'm all for option 2.
This is B. Bass Knight. I totally agree. Our teachers are the finest in the state, and they have just done an amazing, tremendous job thrown into the remote learning. They have covered all the bases. They've done what they've needed to do. But I agree. I think our students need to be in school, and I believe most of our teachers think that same thing, because they want what's best for our students. They want our students to succeed, and I think we will. I know we will. Not with our teachers, I know we will. Okay?
I want to say one more thing. Sorry. You know, Joe, I got to get the last word. And I think Mary Ellen Balance, I feel pretty good that you would all agree that as a board, we are committed to doing whatever's necessary for Dr. Farley to get this staff whatever they need to feel comfortable and safe in their classroom. And that we're committed to those teachers to make sure that they have what they need. And if that means we have to have a special meeting tomorrow night, then have at it. So whatever, I think we can all agree on that, whatever we have to do to make the teachers feel better about doing what needs to be done, we support that.
And we can provide all the equipment, protective equipment, and everything they need. Is that correct, Dr. Farley?
Yes, we've had a allotment of PPEs that's come down from the state, and we've gone well above and beyond with COVID-related funding to provide. In fact, we've got N95s that are coming for teachers that want them, but we've got enough masks for every stakeholder in the district for several months. So our facilities are prepared, our structures are in place, and as I said about 2.5 hours ago, we'll be effective in what we do because we're Dare County Schools, and you know, there's a lot of challenges ahead of us regardless of the model. There's no question.
The question has been called, so I will call for a vote, and because everyone's on the phone, I would like for you to please state your name and your vote, please. We'll start with you, Mr. Hess.
Harvey Hess, I vote in favor of option 2, the motion that's on the floor.
Okay. Mr. Twitty?
I vote yes for option 2.
Mr. Hester?
I vote yes for option 2.
Mr. Tauber?
Yay to the motion, option 2.
Ms. Lawler?
I vote yes to option 2.
Ms. Balance?
I vote yes to option 2.
And B. Bass Knight, I vote yes to option 2. The vote is unanimous for option 2, which places our pre-K through grade 5 students in school 5 days a week, and 6 through 12 in the hybrid model.
School calendar would be next, Madam Chair.
All right, we'll entertain a motion about the school calendar at this point.
Mary Ellen Balance, Madam Chair, I move we approve the school calendar, the revised school calendar for the 2021 as presented.
Motion by
Chair.
Ms. Balance,
Madam Chair, David Twitty, second.
second by Mr. Twitty. Any discussion? All in favor, please say aye.
Aye.
And maybe we should
Madam
vote
Chair,
in voice vote. Is there?
Madam Chair, I'm sorry,
I'm sorry.
whether it's going to be unanimous or not, it's required to be a roll call vote.
I got you. We're going to do a roll call vote then. Mr. Hess?
Yes.
Mr. Twitty?
Aye.
Mr. Hester?
Aye.
Mr. Tauber?
Aye.
Ms. Lawler?
Aye.
Ms. Balance?
Aye.
Ms. Bass Knight, yes. Vote is unanimous to revise the school calendar. I will entertain a motion at this point about the sports,
Madam Chair,
athletics.
Madam Chair, David Twitty, I move a motion that we reopen Dare County Schools athletic program.
Okay, there's a
Effective
motion,
October the 5th.
October 5th.
Second.
There's a motion by Mr. Twitty and a second by
Margaret Lawler.
Ms. Lawler. Any discussion? We will have a roll call vote. Ms. Balance?
Aye.
Ms. Lawler?
Aye.
Mr. Tauber?
Aye.
Mr. Hester?
Aye.
Mr. Twitty?
Aye.
Mr. Hess?
Aye.
Ms. Bass Knight? Yes. Aye. Vote is unanimous. Any other business to come before the board?
No other business, but I'd just like to say, I've only been with you guys for, under a year here now, but I think maybe we've spent as much time together in this 1 year as most boards do in 4 years. And I would like to say I appreciate being on the board with everybody that's here. I know that their hearts are in the right place, and we all have different opinions, but I certainly have a great deal of respect for everybody on this board and everybody at the central office.
Thank you, Mr. Hess. And I want to say thank you to Dr. Farley and his stupendous team, because you have gone above and beyond in the work you have done to make all these preparations to get us back into school and to provide us with so much information. And I know every person on this board has spent sleepless nights looking over the options, reading the comments. I want to, all the folks who are listening, I want to tell all the parents and the teachers, community members, I personally, and I think I speak for everyone on the board, appreciate the comments you've sent. It's been interesting reading. I've read every single one of them, and you've given the board some great insight into what we should do for our children. And I appreciate that. And I see all the board members shaking their heads, yes.
Madam Chair, David Twitty, I have to echo on that. Going home in the evenings and seeing the emails that are coming from not just parents, but a lot of stakeholders in the community giving us some information. So I just want to thank them for reaching out and sharing that information with us.
I do too, and I want to echo that as board members, we are always available to our stakeholders.
Madam Chair, I'd like to make a statement, Joe Tauber. John, I appreciate what you and your staff have done to help us make a well-informed decision here. I mean, I think you've given us the information to make this tough decision, and I appreciate it. So thank you very much.
Thank you for your support, board. I appreciate it.
And this is Margaret Lawler. I would like to thank you in advance for all the hard work you're going to have to do now with this decision that we've made. I cannot imagine being a high school counselor or a high school principal, and I keep looking at your faces over there to read your faces, how you're going to figure out all the scheduling.
I can't imagine being Alex Chandler right now.
Right.
That's the truth.
Or anybody. There's so much that, I mean, we've made this decision and now the work begins. So
That's right.
thank you, everybody, in advance.
Thank you.
And with that,
I will entertain a motion to adjourn.
Madam Chair, this is Margaret Lawler. I move we adjourn.
Motion from
Thank you,
Ms. Lawler
everybody.
to adjourn. And a second from Mr. Twitty. Do we have to do a roll call vote, Rich?
I'm sorry, you do.
You do. Mr. Hess,
I vote we adjourn.
Mr. Twitty,
Yes, we adjourn.
Mr. Hester,
Yes.
I vote we adjourn.
Mr. Tauber, Ms.
Let's
Lawler,
stay 3.5 more hours. I vote we adjourn.
Ms. Balance,
I vote we adjourn.
and Ms. Bass Knight votes to adjourn as well. Thank you. Votes unanimous. Thank you all for spending time on this and coming.